Hey everyone, Dr. Jeffrey Bruening here, sports podiatrist and Diplomate of the American Board of Foot and Ankle Surgery. If you're a runner, there's a good chance you felt it. That aching pain along the medial aspect of your shin bone that shows up a few miles in. We call it shin splints. And most runners either ignore it until it sidelines them, or they rest a couple days and then run right back into it. Today I'm going to walk you through what shin splints are and why you're getting them, and how to fix the root cause, not just the symptom. Let's get into it.
Of all the aches runners push through, this is one of the most common and one of the most misunderstood. I'm Dr. Jeffrey Bruening, sports podiatrist, and today I'm talking about shin splints, or what we clinically call medial tibial stress syndrome. Let's define it. Shin splints is the everyday name for medial tibial stress syndrome. Pain along the inner edge of the shin bone, the tibia. It's an overuse injury, meaning the muscles, tendons, and the bone tissue along the tibia get overloaded and inflamed. The key thing I want you to take away here is that it sits on a spectrum. If you ignore it and keep loading it, medial tibial stress syndrome can progress towards a full tibial stress fracture. So this isn't just a nuisance ache to run through. Why do runners get them? 5 main drivers. First, overpronation. When the arch collapses inwards, it increases the rotational and traction stress on the tibia. This is the foot-type connection. Second, the classic mistake. Increasing mileage. Too much, too soon. Third, worn out or wrong shoes for your foot. Fourth, constantly pounding on hard surfaces like concrete. And fifth, tight calf muscle. When your ankle can't move well, the stress gets shifted up the shin. Notice how many of these come back to mechanics and load management. How do we recognize it? Aching or throbbing along the inner shin. Early on, the pain often shows up at the start of a run, may ease as you warm up, which is exactly why people ignore it. There's tenderness along a broad area of the inner shin bone, and I want you to remember the word broad, because that's how we distinguish it from stress fractures, which are pinpoint. The pain returns and worsens with continued training, and you may see mild swelling in the lower leg. And early management. At the first sign, back off mileage and intensity. Don't push through. Address overpronation with proper footwear or support. Strengthen the calves. The tibialis posterior muscle, that's the most implicated because the medial tibial stress syndrome is exactly where that muscle attaches on the medial tibia. Plus, the hips for overall control are important. Improve your ankle mobility and progress your load gradually with the 10% increase rule. One important distinction to close on. A broad ache is typical shin splints, but that pinpoint pain on the bone can signal a stress fracture, and that needs immediate evaluation, not more running. Overpronators are especially prone to shin splints because of how the arch collapse loads the tibia. Most runners don't know their foot type. Find out in 3 minutes at StrideSmartRun.com. I'm Dr. Jeffrey Bruening. Know your foot type and protect every step.
So that's the real story on shin splints. They're almost always a signal about your training load and your mechanics, not just bad luck. If you take one thing away, this pinpoint pain on the bone is much different from that diffuse ache, and it does warrant getting checked. If you want to understand how your own foot type plays into this, I built a free 3-minute assessment over at StrideSmartRun.com. Links in the description. I'm Dr. Bruening. Know your foot type, protect every step, stride smart, and run fast. I'll see you in the next one.